Ramaiah Memorial Hospital, Bangalore today announced that it has been awarded the prestigious Joint Commission International's Gold Seal of Approval for Hospital Accreditation by demonstrating continuous compliance with its internationally recognized standards. The hospital underwent a rigorous on-site survey conducted under JCI's 8th edition framework, where international expert surveyors evaluated Ramaiah Memorial Hospital for 15 chapters, 237 standards and 1094 measurable elements for its compliance on quality, patient safety and governance. Ramaiah Memorial Hospital achieving the accreditation is a reflection of the hospital's commitment to quality, months of detailed preparation, and the dedication of staff at every level.
We have everything well in that thing. For us, quality is a continuous journey. Accreditation is not a destination. It is just certification from a third party to tell that you follow certain global processes and global standards in meeting the patient thing. So this award coming to us is a wonderful experience for us as a healthcare institution in our state. We have trialed for last 1 year because the audit is not simple in JCI. JCI started in 1994 across the world. It is in 70 countries and hardly about 663 world hospitals are accredited by the JCI. So the standards are very, very stringent. They evaluate us for 1094 steps in a hospital. It starts from entry to exit, from the drinking water to everything, how we operate, how does the anesthesia is given, how does a clinical care is given, how does non-clinical care things. For us, a hospital is a good amalgamation of the clinical services and hospitality. Gone are the days only when the clinical services are focused. Today, the customer expects everything very nicely to be in the hospitality, whether it's a cleanliness, whether how you greet, how you treat, everything is important. So to achieve this, we should have systems. So JCI audited us for 1094 measurable elements. How we measure on that? Based on their accreditation and their examination and audit, the international auditors came and they measured it and they gave this certification to us. We thought it is a very important milestone for Ramaiah Group to achieve that stay, that being a hospital which is belonging to a Gokula Education Trust Medical, under which our Honorable Chairman, who has graced this occasion kindly, to know that one of his sub-institutes have achieved a global recognition today. Sir, thank you very much for coming here to grace this occasion. And I would like to also place upon you that quality is a continuous journey. So this is not just because we get a certification, we cannot relax. We need to keep going, and what is beyond accreditation is something that we should achieve. Ramaiah has a very clear, Ramaiah Memorial has a very clear quality policy which clearly says to be the most preferred hospital in the region. We are not aiming that we are the first, we are the best, nothing. We should be the most preferred by the person to come over to seek health care. We don't wish anybody need to be in a hospital for a what we call as a illness. There is a lot of things that we can do on a wellness also to keep people healthy, to keep those who have disease healthy. These are the what we call as a preventive, curative, rehabilitative and promotive. Suppose we have diabetes, how to keep a diabetes fellow healthy and happy? Those are the avenues that we are looking at, all four aspects of the healthcare to be brought in. This journey is very, very important because hospital is a place where people come with a lot of anxiety and stress. It is important how do we elevate that. Long back Hippocrates said, you may not be able to cure everybody. Can you care for everybody? That is what important. Cure may be possible in few diseases and few conditions, but caring for people is what we should exhibit. The people should feel that we care. To us, our journey starts, our all inductions tell, please treat the person who comes to your doorsteps as if your own family member. If your father, your mother, your children or your brother comes in, can you give the same kind of a courtesy and the clinical care to the person who has come to you? We have moved a long way in healthcare. There was a time when we were thinking patient as a customer, then we treated him as a guest, now we have moved into as a blood relation. Can we try to see that this journey of the customer from client to the our own family member can we achieve? That is a tall order, but I think unless we put the effort, the people's perception of private healthcare will not change. We are making step towards it. In addition to that, a surprise, yesterday we got two very important certifications from two major institutions in the world. American Heart Institute evaluated our chest pain process and certified as a comprehensive chest pain center. You see, I know all of you will be very interested. I think you will meet with the health minister that Hassan episode of people suddenly dying with the cardiac, suspected cardiac issues. So we just on the 2nd of July, we did receive a certification from the American Heart Institute as a comprehensive heart center, which is endorsing the steps done at Ramaiah is equivalent to a world standard in taking care of a person with a chest pain. Similarly, we also got a certificate from an American Stroke Association, that is the neurology and neurosurgeons, who have given comprehensive stroke center. Our emergency is well equipped for this. At the outset, I would like to thank all my staff members. I would like to bow my head for their quality journey that they have taken in this. It's a tall order, tall task. Under the leadership of Madan, the quality team has achieved this accreditation. It is not, for me, reaching top is not the goal. Staying at the top is necessary. You may have got the accreditation. It is a 3-year validity, and every time they come for that validity, they will see what improvement we have done from the last audit. We need to prove them we are progressively taking care of the quality and keeping the patient interest. There are two things the JCI is interested. How do we make the patient safe in our environment? How is our environment means it could be clinical care, engineering care, everything. I would like to just share with you some of the audit experiences. We talk about all fake doctors available. Here, JCI insists that every person's degree has to go through a primary source verification. That means you need to send the degree to the university which has given the degree and qualify and get a acknowledgement from them that this degree is a valid degree. That's a stringent process. We all do these fire drills, we do mock drills, we do emergency drill. One question they asked us is, do you do the drill in the night or you in the day? Most of the time we do the drill in the day. When the staff, they said, no, you should do it in the night. That is the time when only least amount of people are there. How you manage an emergency when least amount of support systems are there? That is the depth they go in to see. So when they measure this 1094 steps, they go through all. I was pleasantly surprised. Internationally, I have faced many accreditations. Here, one international auditor opened the false ceiling, went up and saw on the top of the false ceiling whether the systems are clean or whether it is being maintained. That's a very stringent issue to get a gold seal by the JCI Accreditation body, and we are proud to share it. Along with it, comprehensive cardiac center and a comprehensive stroke care center will add feather to our services, and we will assure you this is a journey, not a destination.
The Chief Executive of the Memorial Hospital, Mr. Madan Gaikwad, the Chief Operating Officer of the Memorial Hospital, and friends. Mr. Narayana Swamy has very extensively has told you about what JCI is all about. We have in India also the accredited systems like NABH, NAC, NIRF, so many other institutions have come for different purposes. And for hospital we have NABHS. So we are all, I think every institution on the hospitals have to go through this standardization of their how they operate. Now this has become most important because the technology is growing very fast, and with technology, danger of utilizing or using the technology in a wrong way also could lead to a very great catastrophe. And we are dealing with human beings more than anything else. So it becomes imperative for the institution to have there should not be any doubts in our system, and we should be so much accustomed to this system of procedures that we should always try to do the best. This is one of the ways is the JCI and NABH. I think in future times, for it may be for other specialties, it may also come out. So I'm sure that all these things are going to, you see, this is ever growing. It's not going to stop here, because the way the medical healthcare systems are growing, it is in leaps and bounds. We can't even imagine what is going to happen next 5 years or 10 years. So with this dynamics that is now within our atmosphere of a hospital management, I think what we have done is that we should take care to see that every one of the the arms of a hospital is perfectly systematically driven, and we must also get back where the systems are. Supposing if they are not up to the mark, we must be able to understand them. That's exactly what JCI does, telling us where the follies are and where you are able to do. So this is a process for making a place of excellence. So friends, I think we need to we need your support, and hospitals are very, very sensitive. And as far as Ramaiah is concerned, we have got a very strong ethical practices. I think we are the oldest in the state having an ethical practice board headed by a High Court judge, no less than a High Court judge. I think it has been there for more than 20 years. So we were beginners in this. And today also our ethical board is very, very stringent, so that we do not, or we should not be able to, unethical practices should not be there. That is the most challenging today, is unethical practice. And all of you are knowing what are the consequences of this unethical practices are. But let me tell you very, very honestly that we follow the procedures very, very stringently. And it's not today, we have lived with this. And one of the reasons why I'm saying this, ethical practices, let me tell you, one of the tests, if you see, anything should have a test. If you pass the test without your knowing, then you have passed it. So one test that came to us in this century was COVID-19 during that time, pandemic. COVID-19, okay, the pandemic during that time, I remember that we were the first institution, I think only 2 institutions in Karnataka went to the government and said, all the 1,300 beds are at your disposal. And I'm proud to say that we and other teaching hospitals like St. John's were there. And so we are, and they were also in the same manner, they said, all our 600 beds are meant for the pandemic. So that is the way in which we have, we did not look to either any other things, but to see how we can save the lives of the people. That is the most important. Secondly, when we did this, we were very ethically also, we were very cautious in seeing what is the expenditure that can be gone. It is all to the poor people, or to the downtrodden people, or the unprivileged people. So anybody can come, anybody can have. It could be also the people who are affluent. So the question was, when they come, what is the cost that we should charge them? So when we went and when we made the assessment, the government, when they saw the assessment, they did not know what to say, how to subsidize, what is the money to be given, what should be charged by everybody. They took our as a standard, and they said 15,000 rupees should be charged for every patient for having got this treatment. So that was the ethical that we did, and government accepted it, and they gave in turn even the money what was reimbursed or given to the institutions or the hospitals were on the basis of what we spent the money, and they were sure that we were very correct. So this is one of where we were tested. So we passed the test, and God's grace, we have done it well. So this is our culture. This is what we are going. So ethically, we are very, very cautious and very alert that nothing unethical can happen in this campus. So with these few of my impressions, I hope you have got a number of questions, and Mr. Nagendra Swami and Mr. Gaikwad are here to answer your questions, because those questions I will not be able to answer. They are the right people to answer. So please put in any questions, and they are there to take for you. Thank you.
It is to rededicate yourself that I will do more better than what I am doing. Now that we have gone through this journey, we have gone through the difference between there are very good points in NABH, there are very good points in JCI. Both have some common elements of quality into it. What we learnt is there is a lot of importance to be given to the patient safety as a whole. So we need to get into a larger aspects of how a consent is taken, how the patient is explained, financial liability and the clinical liability. Both are important for a paying patient. And today, the expectations of the patient is, as I told, the hospitality. How do we sure when he comes he is greeted, treated, and how is his food, how is his bathroom, how is his other things. Similarly, safety issues. How do you take care that he won't fall from the bed? How often you make the thing? How often you make sure when he goes to the bathroom bathroom is safe, is not slippery, and it has got a call bell so that any emergency in the bathroom he is able to attend to you. Similarly, we have to do, there are many stringent drills, like in a sudden patient's heart stops or anything, how a code blue will happen, how a code red in fire happen. And also another thing, babies theft will happen in the thing. How will you prevent that code? How will you do that? Then there is a disaster management drill. That means a public disaster, a massive casualty will come. A bus accident happens. Suddenly 30, 40 people will come. What arrangements you will have to attend a mass casualty kind of a thing. To that extent, we are listed out the areas of improvement, and we most probably the auditors when they come, they would like to see where all we have improved for the next round of thing. The JCI insists it is not just meeting the standard. Meeting the standard is a basic requirement. Are you improving on that standard is what they want to see in the next round of thing. That is the agenda between us. As Sir said, COVID has really pushed.
My question was that, how you want to improve beyond that benchmark?
That is why we have marked out the areas where there is a scope for us to do better. For example,
this journey of us in accrediting with the JCI, a lot of people did ask, you also have the NABH as well as the NABL for the laboratory. You're already doing good work, but why this? We may be doing good, but we want to do great work. Just like Sir William Osler, considered to be one of the greatest physicians of the last century, said that a good physician treats the disease, but a great physician treats the human being with the disease. So that's what we want to follow. The journey has been very exciting. We have learned a lot, great learning. The benchmarks are international level. It's not national level, it is much international level. So with that, we hope to improve further. Step by step, we want to improve. Having said that, I express my sincere thanks and gratitude to all our media friends. As we know, media is the eyes and ears of the public. Thank you very much for coming, gracing, looking at our